What is CBT, DBT, and what are other options for ADHD treatment? Hi, I'm Michelle Frank, a clinical psychologist who helps people with ADHD. Today I'll be answering some of the internet's biggest questions about ADHD treatment terms. What are the options for ADHD treatment? It's pretty simple and straightforward. Medication, therapy like CBT or a mindfulness-based practice, and skills training or coaching. What we do know is that a combination of these three things is the most effective way to treat ADHD. What is cognitive behavioral therapy? So cognitive behavioral therapy, or CBT, is a type of talk therapy. It really focuses on thoughts, feelings, and behaviors. It's probably the most studied therapeutic modality out there, especially for ADHD, and it's been shown to be quite effective in helping people manage ADHD. To be clear, it doesn't make you have better memory somehow, but it does help you cope with your challenges differently, including how you think about your challenges, your self-talk, but even how you think about showing up and doing something that feels hard for you. What it really does is help you figure out how to manage ADHD in a way that works for you. What is dialectical behavior therapy? Dialectical behavioral therapy, quite a mouthful, is also called DBT. It's a form of CBT, which is a therapeutic treatment for ADHD. What I really like about DBT is that it helps people learn how to skillfully manage their emotional responses. It helps them turn down the volume on what they're experiencing using some tried and true coping skills. It also helps people learn how to be more assertive in their relationships, something that a lot of people with ADHD could use. It can be hard to express your needs, your intense emotions, or the differences that you have. DBT helps pull all of these things together in a way that works for you. Oh, and if you're enjoying this video so far, make sure to check out our channel. There you can find even more helpful content about ADHD. What is acceptance and commitment therapy? So acceptance and commitment therapy, or ACT, is a type of CBT. It's a type of talk therapy that can be used for ADHD. In traditional CBT, we would work on pausing, noticing, and then changing negative thought patterns. ACT does it a little bit differently. With ACT, you say, how can I be present and notice my thoughts, but then get space from them? Get out of the tug of war of trying to change them and get a bit of distance so that we don't fuse with unhelpful thoughts or overwhelming feelings, which is really common for people with ADHD. It places heavy emphasis on value-guided actions, identifying what's important to you, recognizing that all we have is here and now and how we want to show up authentically in the world, and making decisions off of that instead of getting stuck in our struggles. I'd say ACT is really good for people who want to prioritize their values and intentions and want to take more of a mindful or gentle approach to working with their inner experience rather than be in conflict so much with them. What does multimodal treatment mean? This is actually a great question because in looking up ADHD treatments, you've probably come across the word multimodal. It's a fancy way to say a combination of things. What we know is most efficacious for folks with ADHD is a combination of medication, therapy, maybe cognitive behavioral therapy, mindfulness, and some sort of coaching or skills training. So when we're looking at the best treatment for ADHD, it usually combines these things alongside some scientifically proven lifestyle changes, such as increasing exercise and getting better sleep. And for kiddos, this could look like a social skills program at school and occupational therapy, where they work on regulating hyperactivity and motor functioning or emotional control. We can also begin to look at accommodations at school or in the workplace to help people feel more supported in their challenges. What is neurofeedback? So I'll start with saying what it's not. It's not medication and it's not talk therapy. It looks a bit different, but the best way to explain it is probably in an example. It's a sort of thing where you go to an office and you get set up with a TV or sort of like a video game scenario, and they actually put electrodes on your head so they can tell if you're in a relaxed state or an alert state, and then use that information to guide you towards whatever's desired. If you're someone with anxiety, maybe they want to move you more relaxed. If you're someone with ADHD, where we know some of those slower brain waves creep in a bit too much, they might want to help you begin to notice alertness differently and then recognize it and be able to stay in that space. So they change up the movie you're watching or the video game. And the idea is that over time, you can change your brainwave patterns with these new inputs and cues. Did you like this video? Because we have a lot more resources like this on our channel. So go ahead and subscribe to get the latest research and tips from top experts like me on learning and thinking differences like ADHD and dyslexia.